For an entire week, we get to host a multi-disciplinary team from the USOPC with the medical providers. We had the privilege of our team to be asked by the American Academy of Neurology to kind of write their main guidelines for patients and caregivers on how to care for concussion. Our model is one where we sort of evaluate an individual and figure out exactly what symptoms they're having so that we can target our treatments around the symptoms they have. So it's not a one-size-fits-all approach to our athletes. It does require a team of different disciplines kind of doing these assessments and working together to figure out the best way we can bring these together for optimal treatment.
We have people from Colorado, California, and Lake Placid, New York, all as different members of USOPC coming to learn from us and learn to how we can collaborate and help out their athletes a little bit more. I think it's an honor and a privilege to kind of be a part of USOPC. I think we've always known that we've had something special here at UF with our interdisciplinary model with neurologists and neuropsychologists and PT and OTs all in the same space. And so it's nice to feel appreciated and know that what we're doing can help other people, and especially helping Team USA.
A lot of the challenges we face are very similar to theirs. They may have more challenges in some areas and we have more in others. So it's really been fun and interesting time just to share those experiences and ideas.
You can have, trauma from all kinds of different situations, being hit in the head, even trauma from falls where you don't overtly hit your head. So it's important to kind of be aware of all the different presentations of brain injuries, as well as how individuals can present brain injuries differently, and to be very aware of the different considerations and symptom timelines, recovery timelines, and how to help athletes get back to play as quickly and safely as possible.
I presented to the USOPC faculty on the role of neurologic occupational therapy in management of concussion symptoms. I feel very proud of being able to work with the multidisciplinary concussion team at the Fixell Institute, and I feel proud to be able to share that with the USOPC faculty.
We do a very multidisciplinary treatment for concussion in relation to the athletes. And that's from looking at their whole aspects, whether it's from their cognitive, headache, ocular, vestibular, sleep, and mood components to give them the best overall care and the best performance.
UF Health is the integration of so many different aspects of care, not just medical, but also physical, occupational, vestibular, psychology. All of these aspects are intertwined with an interprofessional team of experts who are dedicated in a singular focus on trying to get these patients better.
I think U of F was a great partner for this just because of, one, the clinical expertise. There's a lot of very smart, very talented, educated, and experienced providers across a plethora of conditions and specialties. It's been a phenomenal service and working with the faculty there to really do a deep dive on head injuries and all the associated conditions that go with it, and being able to take some of those clinical skills, knowledge, take them back to utilize with Team USA athletes and para-athletes.
I think the biggest takeaway for me is the multidisciplinary concept that exists here and how fluid that handoff is between providers and patients. Today we were able to see a full workup, and that was really incredible to see the team work side by side together and make sure that this patient got the absolute best care possible. It's really great to see this firsthand on how they approach the athlete and to see that continuity of care and just that compassion with all of the providers talking about the athletes and discussing the case and providing the optimal care for them.
One of the things we've been able to take away is how do we take some of those really intricate systems that they're working in and extrapolate it into the complex and often geographically disparate system that we work in, and utilize those skills and those really important facets that they're all coming together to pull and make the most out of what we can do in our system in different parts of the world and different parts of the country.
We always knew that University of Florida was a powerhouse. So I would think that the reputation stands really tall across the country because anybody, you say I'm going to the University of Florida and they know exactly what that means. And we are so ready to watch Team USA go out there and rock the house.